My name is Adam Johnson, and some of you perhaps have attended previous webinars covering this Science of Endobiogeny course. Perhaps some of you, this is your first time. Um, and if you've attended any of the previous webinars, topics such as what this course entails and what is endobiogeny were covered. We're certainly going to cover a lot of those ideas again today, but this presentation is going to be different than prior conversations. This will take on a little bit more of a different perspective, perhaps even a more philosophical angle, because that's my background. And today I've actually been asked to get a little bit personal, even a little bit autobiographical, and discuss why I chose to shift from a thriving practice in emergency medicine to the practice of endobiogeny. Uh, my experience with life has taught me that each of you has something very fascinating about your life journey that would be very interesting to hear. And I'd love to hear your stories. And I actually don't really like talking about myself. So this is quite uncomfortable for me. But I've been asked to share my personal story in hopes that it will give some of you some insight and perhaps some courage in taking the next steps in learning about endobiogeny, the science of endobiogeny, and how you can incorporate it into your medical practice. Um, but in order to set the stage for this conversation, I want to describe sort of the what was at stake in my life. You see, my position in emergency medicine was about as good as it could possibly get. My location was optimal. My pay was excellent. My partners and my hospital setting were about as ideal as one could hope for. I live in a town of about 10,000 full-time residents, but we welcome about 1 million tourists a year because it's the gateway to two national parks. And that brought with it a lot of interesting cases. People come from all over the world to my area and they bring with them their diseases, and it was very diverse. It was very exciting. And I lived in a really great place. And there's a certain amount of social status that comes when you're kind of a hero in a small mountain community in a beautiful location. It was kind of cool. So from an outside perspective, I have really found the crown jewel of jobs in emergency medicine. I live in Jacksonville, Wyoming. It's awesome. So why leave such an ideal situation? Especially when I have 4 children to provide for and a mortgage to pay for. From an outside perspective, from what I had, it looked like pure irrational lunacy, especially to leave what I have to do something like endobiogeny, because this was a field that nobody had heard of. It was a field that some people viewed rather skeptically. It was a field that was not formally acknowledged by US medical boards. And from an uninformed perspective, some of my co-professionals might even look at what I do now as approaching pseudoscience. And I want to state it in the harshest terms possible to help you understand why I had the courage to make this switch. Because sometimes it can be very hard to differentiate what is pseudo from what is revolutionary. But as I get into my story, I hope to share with you how truly revolutionary endobiogeny and the genius that went behind this truly is. Endobiogeny is not business as usual, normal medicine. It is a fundamental, different mental framing. And for me, once I started seeing the world through the lens of endobiogeny, I couldn't see the world any different. I was permanently changed. Initially, I brought this vision into my practice of emergency medicine, and eventually it became so compelling that I had to leave full-time emergency medicine practice and devote my career to practicing emergency medicine, and to practicing endobiogeny full-time. So I want to tell you my story. First of all, the overview of our presentation today. I'm going to share my personal story moving from a career in emergency medicine into endobiogeny. And part and parcel with this story, I'm going to share with you about the theory of endobiogeny and what, in my mind, makes it so revolutionary. And then we'll have a little bit of a break and we'll transition into the actual course that hopefully you will sign up for and participate in. I will be one of the co-instructors for the course, along with Dr. Kamyar Hidayat, who perhaps you've seen him present in some of these previous webinars. So some of my most important mentors in life are actually dead philosophers. That is my background. That's my first love is philosophy, and I've taken a lot of courage from the likes of Nietzsche, Kierkegaard, and Simone de Beauvoir, who I have quoted here, who she says, "I tore myself away from the safe comforts of certainty through my love for the truth, and the truth rewarded me." That photo there is my son, just down the road from where I live. I live in a beautiful place, and I bring this quote up from de Beauvoir for a reason. I want to share with you my personal background. I've had a lot of aspiring young students who have come to me wanting to pursue a career in medicine, and they want my advice. In the United States, before you can attend medical school, you have to attend at least 4 years of university study before applying to medical school. And in those 4 years of university, you have to uh, take a number of courses in the sciences that are relevant to going into medical school, prerequisites, as it were. And the most efficient way to go through that process is take those 4 years of university work and study one of the sciences. And so I have students who come to me and they say, "Hey, what's going to be most advantageous for me and my long-term goals to practice medicine? What's going to help me be the best physician possible? Should I study neuroscience? Should I study biochemistry or biophysics?" And they want my advice. And I look at them and I probably sound like an absolute heretic because I look at them right in the eyes and I tell them, "Hey, medicine isn't about science." And they look at me dumbfounded and wonder what I'm talking about. And I expand and I say, medicine certainly includes science, but medicine fundamentally is about humanity. And so, what I would recommend doing for you is to take this time at university and study from the best thinkers of all history what it means to be truly human. And along with that, you should take all the necessary prerequisite science courses because that's also part of understanding humanity. And that'll better equip you to going into medical school and being the best doctor possible. Well, so far, I've had exactly 0 people listen to that advice and take me up on it, but that's the path that I chose. Before attending medical school, I first studied religion and spirituality. I lived in Sweden for 2 years and worked full time in a church community as a minister. I then returned and I studied philosophy and literature for 5 years at the university, while also doing the necessary coursework in the sciences in order to get into medical school. After that, I attended medical school for 4 years. And then I went into my training in emergency medicine at the University of Massachusetts for an additional 3 years. And I practiced emergency medicine for nearly 18 years before transitioning to full-time emergency medicine. I share that background with you because my life has been very much directed and informed by my desire to understand what it means to be truly human, and it's been informed by philosophy. And so this talk is definitely going to take on a bit of a philosophical angle. And as I've gone through my career, I went through what I would call different stages of mental, emotional career development. And I kept on superimposing ideas from Nietzsche and Kierkegaard and Simone de Beauvoir and psychologists like Erik Erikson and Jean Piaget and Kohlberg and others who really tried to think about stages of human development. And I went through these stages in my career. Initially, I was in the stage of simplicity. I practiced normal medicine. I relied on expert consensus-based guidelines experts in my field who told me how to practice emergency medicine, what was good, what was bad. I could hide behind another specialist. I could refer people to other specialties when I couldn't figure out the answer. Life was good. I could hide behind this level of simplicity. But unfortunately, I kept on running into problems that seemed like unsolvable problems or unsolvable puzzles, really. I got tired of seeing patients who would see one specialist after another and ultimately still have no explanation for their symptoms or a viable therapeutic strategy that was helping them. I was tired with fighting with the admitting team to tell them that even though a patient had normal diagnostic workup, they were too sick to be sent home, and they really needed to be admitted. And they couldn't understand my rationale for making those recommendations. And I really became frustrated with the limitations of what we can understand about disease and healing. So I moved from this stage of simplicity into the world of complexity. And it was challenging. And I kept on persisting and I kept on asking questions. I became quite critical of groupthink within the medical education. I became very aware of the blind spots that have persisted in our collective medical thinking. I became disillusioned because of the shaky foundation upon which a lot of our decisions in medicine have been built up on. Studies that maybe were um, studies that have been maybe done once but never been reproducible, and yet the fundamental underpinning of all scientific inquiry is the reproducibility of an experiment. And we were really standing on some pretty shaky ground, it seemed like. But I became cynical. I became a bit jaded. I became a bit burned out, and I became perplexed. And this is a very scary situation to be in a situation of perplexity, to look at all the things that we think that we know in medicine and realize that what we know really amounts to next to nothing. And after a while, I became cynical of my own cynicism. I became sick of my sickness. And I came to the conclusion that really, while we don't know much about this beautiful, terrifying world, we do know enough to do a lot of good. And luckily, I was able to move out of that existential, scary realm of perplexity. And I started looking into other forms of healing and diagnosis. I looked into Chinese medicine. I looked into traditional herbalism. I looked into other training programs like integrative medicine, functional medicine, and so forth. And I tried to incorporate this new understanding into my practice, still in emergency medicine. But ultimately, I was still practicing a version of normal medicine. It had a slightly different flavor, but there was really nothing revolutionary or fundamentally different about how I understood the world. It was just that I had an expanded toolbox. But ultimately, it did help me move into the world of what I would consider a more harmonious view of practicing medicine. And then I kept on being plagued by some unanswered questions. And I went back to my hobby of studying philosophy and history, and I encountered the work of Thomas Kuhn in his 1962 work entitled "The Structure of Scientific Revolutions." Now, in this book, Thomas Kuhn is calling into question another fundamental assumption that's been made for centuries. This assumption is that about the notion of scientific progress. As a historian of science, he's coming from a pretty unique perspective here. He See, the assumption has always been that science proceeds in a more or less linear way, is cumulative, always building on the science that came before it, more or less in one direction. But Thomas Kuhn offered a different explanation for what's happening. Kuhn says that when you take a step back and you look at the history of science more broadly, what you see is that the history of science is a series of scientific revolutions. Then, in between these revolutions, were long, stable periods where scientists were doing what he calls normal science, only to inevitably run into another scientific revolution. So I read this and I thought, well, that's where I'm at. We're doing normal medicine. We've been doing it for a long time. Now, getting back to Thomas Kuhn, he gives examples that there's this example of a revolution in the vein of Newton and Galileo and Copernicus and Einstein, where there's a new set of premises and there's a new way of looking at the universe. There's a new way of doing science. And people do that science, they conduct experiments, they make progress, and then inevitably they come into seemingly unsolvable problems. Those problems pile up, and the more those problems pile up, it erodes at our confidence and we become perplexed. Well, that resonated with me. I felt like that's what I was running up about into. The tools that I had at my disposal were not sufficient. And so I felt like there's got to be another way of looking at this. Now, people like Copernicus and Galileo and Newton and Einstein, they worked and thought in a way that was completely different than any of the science that the day supported. When Copernicus came out with his book in 1953, he was sorry, 1543 rather, that was Copernicus. He was seen as a pseudoscientist. And Thomas Kuhn says that the scientists of his day were perfectly right for thinking of him in this way because nothing he was saying corresponded with any of the best science of their time. I mean, imagine if you had a theory today that was contrary to the best theory of our time. It can sometimes be hard to separate the pseudo from the revolutionary. But I was looking for something that challenged me, something that stretched me, something that really taxed my view of seeing the world. And then I encountered the work of Dr. Christian Durafort in the theory of endobiogeny. And I immediately recognized it as not normal science. This was not business as usual. This was a revolutionary way of thinking. And I want to share why that is. So this really kind of comes back to a very age-old or discussion dynamic between this framing of the world of becoming versus being. And this can really be traced back to ancient Greece or even beyond. You have Heraclitus on the one side, on the one hand, who viewed the world as in a state of constant flux. And then you have Parmenides on the other side, who felt that things were in a certain ideal form and that things are more or less unchanging. We have this material view of the world versus a process view of the world, being versus becoming. Now, in Western medicine in particular, we predominantly are in the camp of being. We this is the way things are in the universe. This is a very material aspect of our way of thinking. Our jobs as physician are to use whatever tools we have available to figure out the way things are. There is a way things are in the world, and now let's categorize and understand it. So, and then we treat the condition that is. Now, we can take this even a step further. For example, we have a certain psychology that in many ways seems mysterious to us, but it can be understood by appealing to the more fundamental field known as biology. And now our biology is very complex, but in many ways it can be understood by our knowledge of this elaborate confluence of chemical reactions, atoms and molecules that we know as chemistry. But those atoms and molecules can be better understood when looked at them through the lens of physics. So physics begets chemistry, which begets biology, which then begets psychology. In other words, the thinking is if we can just thoroughly understand the physics and the material components that make something up, then we can understand higher processes like psychology that remain mostly mysterious to us. Now, this is helpful and this has utility. It's given us a lot of progress in the world, but it's very different than looking at the world in this from the position of becoming. Becoming is more of a process-oriented way of thinking. So take a few steps back. In fact, take a few light years worth of steps back and look at the world from a completely different perspective outside of our solar system. And what you'll actually see is that we are hurling through space at over 100,000 kilometers an hour, and we're spiraling around a sun, which is also hurling through the Milky Way at over 800,000 kilometers an hour. And things are in the process of constantly changing, but often we don't have the tools to be able to see it. But to have a tool to understand this process of change and adaptation allows us to move through life in a much more life-affirming process than simply looking at things from a strictly material perspective. So that's what endobiogeny starts bringing to the table. It's looking at things through the lens of adaptation. It's more of a process-oriented view, where the idea is that you cannot stay still in a moving universe. And if we want to really understand things in a different way, we need to understand the rate and the nature of how things are moving. So if health is a moving target, if health is very dynamic, isn't it, doesn't it make sense to try to understand how things are moving and how we are adapting to that dynamic? And that's what endobiogeny brings to the table. So I want to illustrate this in maybe a little bit more concrete way. So some of you have had the situation where you've dealing with an illness. Maybe it's a severe illness, say mental illness, for example, and yet diagnostic tests are more or less normal. So then we end up treating the symptom. And we have these elaborate ways of understanding the neurochemistry behind mental illness and so forth. But a lot of our diagnostic tests, when they're treating somebody with bipolar or unipolar depression or anxiety, a lot of our tests can look normal. Um, and I took care of lots of patients in the emergency department who come in a mental health crisis, suicidal, and they have normal lab biomarkers. What do you do in those circumstances? Well, let me give you an analogy. Many of you perhaps have needed to buy a new piece of furniture. When I was raising when my children were young, I needed to get a new piece of bedroom furniture, and so I would take a trip to IKEA, for example. And I go down to IKEA and I pick out a a bed for a crib for my child, and I find one and I grab a bag of meatballs on my way out and I go home to put it together. Now, in example A, I go home and I look at all the components that are in the box and I double check to make sure that all the material that I have to put that box, that table together, that crib together, they're the right parts. And I follow directions and I put together a crib. And that's one way of doing it. The other example, example B, is that I come home and instead of following the directions, I confirm that all the right parts are in the box, but instead of following the directions, I assemble that crib it just however I want to. I put one piece on the floor. I put one piece on top of it. I get all the box of bolts and nuts, and I just put it in a pile, and I turn it into a piece of abstract art. Now, they're both made out of the same parts, and yet they don't resemble one another at all. And this is just an illustration of how, even though all the parts are correct in both situations, in the end, they turn into very fundamentally different things that you're looking at. That is to say that the order and the process of how things are assembled matter. So this is why, in a sense, the analogy is you can look at an entire panel of biomarkers and they are normal. And that can be like looking at this box of IKEA furniture and saying, all the materials that I need to assemble this are the right materials. But the order of how things are put together, it matters. And our current instruments don't tell us the order of how things are unfolding. Wouldn't that be helpful to give us an idea of how things are being put together? The timing, the pace, the intensity of physiologic signals. Wouldn't that be helpful? And that's what endobiogeny tries to understand. I'm going to give you another example. This is more of a musical example. And in this video that I'm about to play, I play three notes. And I'm going to play the three notes in three different ways. They're the right notes. In all cases, they are the right notes. But only the last example is correct. Only the last example belongs in the piece of music that is intended to be played. So I'm gonna give you the example, and you just listen.
Oh, we're unable to hear the video.
Oh, we're not. No, no video.
But we can see it, we just can't hear it.
Okay. Well, I guess I'm told that you cannot hear that. Well, that didn't work then. My apologies. The point is that there are three notes that were played in three different ways, but the intensity and the order of those notes meant that it turned into a completely different song altogether. And only one of them belonged in that piece of Bach that I was just playing. So all that is to say is that if notes can be a metaphor for biomarkers, wouldn't it be helpful to understand the unfolding, the dynamic intensity of different physiologic processes? So that is the level of revolutionary thinking that is brought to the table with endobiogeny. So instead of just looking at an static material view, endobiogeny takes things a step further. The premise is that when you understand some of the fundamental drivers behind certain key biomarkers, when you look at them in mathematical relationship to one another, you can infer and derive a lot more information about the intensity, the order, and the sequence of how things are unfolding in a more dynamic fashion. And that adds a layer of insight and direction of therapeutic direction that you can offer to a patient. And it is truly different. So, what is the theory of endobiogeny? Now, I've had people tell me that they hear that I practice natural herbal medicine, and that is true. I incorporate a lot of herbalism and herbal treatments into my therapeutic strategies. But endobiogeny is not a different version of medical herbalism. Endobiogeny is a philosophical framework. It's based on whole systems thinking, unfractionated. It's looking at the material aspect that we discussed. It looks at the dynamic, unfolding, process-oriented view of the world, and it uses the most fundamental language of all, mathematics, to look at the dynamic unfolding of an interconnectedness of life. It's informed by modern scientific understanding of physiology and mathematics. It's informed by modern systems philosophy, and it has a few advantages. One is that it really respects the whole person, uh, not just one aspect of what that person needs. It is rooted in contemporary science. And it uses both standard medical as well as traditional healing modalities. So the depth that endobiology brings to patient care is not by turning up the metaphorical power of the microscope into higher and higher powers of magnification. That's what's been happening with medicine. You more and more these days, we go into medical school and then we are in a sense, directed in one uh, really focused medical group or another. We go into cardiology, or we go into pulmonology, or we go into neurology or psychiatry. These areas of hyperfocus where you really turn up the power and magnifications in a particular area. And those are really, really helpful and important things to understand and really be able to magnify. But at the same time, it's also important to step away from the microscope altogether and look at how all of this is interconnected as a whole. And so we need people who also do that. And so the depth of endobiogeny is in looking at the entire terrain of the patient and its interconnection, unfractionated. And so this little flower, very diminutive flower that can be missed, Linnea borealis. I named my medical practice after this little flower. It's also known in English as the twin flower, and I named my medical practice after this twin flower because of the symbolism behind it. It's it looks as though there's two flowers, but it's not. It's one flower with two parts to it. And the reason why I like the symbolism behind this is that endobiogeny does not reject standard medical practice. It doesn't reject a material view of the world that has a lot of that's given us a lot of important tools, and it doesn't simply embrace a natural herbal perspective. It doesn't embrace simply a process-oriented view of the world. It embraces both. It's trying to understand life in its all of its complexity, both in its dynamic unfolding and its more of its material uh, presence and unfolding as well. So as we go through a medical evaluation in endobiogeny, really what it amounts to is, or another way of explaining endobiogeny, is it amounts to stress and adaptation medicine. Now, as we uh, as we go through life, we come into this world with a certain amount of capacity to deal with the stresses that come at us. From the moment we are conceived in our mother's womb, we have to adapt to stress. Some of those stresses might come at us in the form of a genetic inheritance. Some of them might come in the form of early childhood trauma. It might come in the form of illness or injury. It might come in the form of a very stressful work situation and night shifts and so on. But as we encounter these stresses of life, we have to deal with it physiologically. And if we're doing really well in life, we have our bad days, we have our bad weeks, bad months, and we recover. Our capacity improves and we go on living. And if we encounter a stress that's either big enough or repeated enough or sustained long enough, then we might get depleted in our capacity sufficient that we can't fully recover on our own. And then we have symptoms of disease or dis-ease. And we might have symptoms that are very physical, migraines, asthma, acne, and so forth. And we might have symptoms that are more psycho and emotional, irritability, overwhelm, burnout, anxiety, feeling numb and disconnected, overwhelmed, withdrawn. All of those can be seen as evidence that our capacity has been reduced. Our physiologic capacity has been reduced. And in the process of an endobiogenic evaluation, we take lab biomarkers, we look at them in mathematical relationship to one another to get an idea for the dynamic unfolding of how you are adapting to stress and life, and where you are under adapting or over adapting, where you've been depleted, and we can come up with a very thoughtful, rational understanding of what you need or the patient needs in order to become more whole. So seeing things through this lens can give us a very different view. For example, 10 patients with depression may be depleted in their physiologic capacity in 10 different ways. And so we don't treat them the same. We treat them according to their terrain, what is out of balance, where they've been depleted, where their capacity has been uh, um, depleted sufficiently that they're having symptoms. And we can come up with a very thoughtful strategy for helping to improve their capacity. And as their terrain and as their buffering capacity improves, their symptoms resolve. I'm going to illustrate this another way. So just to compare and contrast classical and other types of integrative medicine with an endobiogenic approach. Often we see things as cause and effect, and there's a lot of talk especially in the health and wellness space of root cause. What's the root cause of this illness? And you can even see commercials on television in the US with very expensive drugs that claim to treat the root cause of somebody's disease. And It's not uncommon for somebody to say, oh, well, inflammation. Inflammation is the root cause of their disease. We need to treat the inflammation. We need to suppress the inflammation. Well, let me walk you through this slide here. First, we have symptoms. That can be asthma, it can be depression, it can be cancer, and so forth. And then what drives the symptoms? Well, it can be this is the mechanism of disease. This can be imbalances in nerve signals. It can be inflammation, but this is simply the mechanism. It's the driver. It is still not the root cause. And yet, both endobiogeny and classical medicine that we acknowledge this. This is sort of the how behind disease. Now, as taking a step further, people will point to the aggressor. For example, poor sleep or poor nutrition or genetics or illness such as COVID, for example. These are aggressors, and this might get pointed at as the root cause. What endobiogeny offers to as a perspective is something even more fundamental. It's what I would describe as the true cause, which is the foundation, which is physiologic imbalances in the terrain, the physiologic landscape of somebody's body, the timing, the duration, the efficiency, the speed of communication between your endocrine system, your immune system, and your nervous system, the autonomic nervous system, as an ensemble, how those are all interacting, and then another added layer of insight with endobiogeny is this section up here, the body's response. When you are encountering an aggressor like poor sleep or nutrition or genetics, how are you responding to this? Are you over responding? Are you under responding? And this, we can see areas of where your physiology can get maladapted. And so people ask me sometimes, what types of patients do you see? And I have about every type of disease condition you can think of that come to me for further help and support. I have patients who have cancer, either active cancer or patients in remission. I have patients with inborn errors of metabolism and other congenital problems. I have patients with Alzheimer's. I have patients with heart disease. I have patients with a lot of autoimmune conditions, and certainly a big portion of my practice has to do with mental illness because that seems to be a particular area where we have very few diagnostic tests to help guide therapeutic modalities. Uh, so I have patients with across the spectrum, old and young, and just about every disease. And endobiogeny can help give insights and support in all of these, even in situations where somebody has inborn errors of metabolism or something, a congenital genetic issue. We might not, we're not gonna cure some of these genetic issues, but we can certainly identify where the body has been compensating, maybe overcompensating or undercompensating as a result of that genetic inheritance. And we can do things to help support that. So just about everything that you can encounter as a medical provider can be helped with endobiogeny. The process typically is in a very elaborate history interview with the patient. Depending on your practice style, typically that also involves a very thorough physical examination. And then, of course, what endobiogeny brings to the table as well is a unique way of evaluating blood work. So I'm pulling this up. This you can you have the URL here, but GEMMA is a proprietary medical calculator that allows us to evaluate lab data in a more dynamic view. This is the analytical tool that allows us to get more insight, not just in terms of what your actual blood lab values are, but this gives us insight into um, order, intensity of signal, duration of action of different physiologic processes. This is a very useful and very powerful tool in analyzing where somebody's capacity has been depleted. This is proprietary algorithms that help us understand these imbalances, and this can help both screening and prevention. It can be used for as a diagnostic aid and as a therapeutic aid. There are situations where I'm dealing with a patient with depression, and it would be absolutely appropriate to use an SSRI as part of their treatment. And then there are other times when that would be absolutely not appropriate, even though they have depression, and that is often considered a first line therapeutic. But based on their physiologic imbalances, I can have a very clear direction on a way forward. Additionally, I do have people who are quite healthy in general, and they come to me saying, I want to stay healthy. I want to, I don't want to be reactive to my health. I want to be preventative. And so they come to me and they say, I've got a family history of Alzheimer's, for example, and I really want to do everything in my power to try to prevent that. And we can do screening and true prevention because based on the way their physiology is unfolding in a dynamic fashion, we can say, well, actually, the way that your physiology is right now does favor a risk of developing Alzheimer's in 30 or more years, or it does not. And we want to keep it this way. And these are the things we can do to keep your physiology working in a more favorable direction. So it's very helpful for both screening and prevention. It helps with selecting therapeutic aid choices, and it also helps us identify really what's going on as a diagnostic tool. This also has the advantage of offering a very cost-effective way of approaching supporting somebody's health for a wide range of conditions. So as you get the results from this GEMMA panel, this medical calculator, not only does it give you a guide to interpreting the results, it also will describe recommended interventions. It gives you ideas related to pharmaceuticals. It gives you ideas related to herbal remedies that could be appropriate for that person's condition. It gives you ideas related to diet and lifestyle and environmental modifications. It's very whole person centered. Um, it also gives insight related to drug-herb, and herb-herb interactions. And today's day and age, there's a very uh, fast-growing area of interest and acceptance in herbalism as a part of somebody's treatment program. When I was going through medical school, um, I'll just tell you if at any point in my life I felt like there was a bit of almost brainwashing. It occurred while I was in medical school, where there was a very strong dogma that anything outside of how we practice medicine is not evidence-based, and you are a heretic for considering anything else. And I was, even though I had an early interest in herbalism, I had to keep that quite quiet for a long time. And as I went through my career, early in my career, I was working a lot of night shifts in the emergency department, and I uh, was having a conversation about how depleting working a night shift can be over time. And I was discussing with one of my colleagues, and I said, "Hey, instead of consuming, coffee and carbs all night to get through your night shift, uh, how about would you be interested if I told you how I do this? I take an herb called rhodiola and another medicinal mushroom called cordyceps. And I take those herbs at the start of my shift, and they help me get through my shift with a lot of mental clarity, and they help me recover a lot better on the end. And I said this to my colleagues early in my career, and and they looked at me like I had three heads, and I was some sort of uh, crazy hippie for even suggesting this. And so I just sort of kept it to myself, and I kept on doing what I thought was best for me, and I would still offer similar suggestions to my patients if it seemed appropriate. And then as I progressed in my career, it became very clear that doctors, medical doctors, often choose not to do the very therapies that they are recommending for their own patients a significant number of the percentage of the time. Why is that? Because we of anybody know of the undesirable side effects, and if we can avoid that, we do. And so there's a very uh, fast growing percentage of medical doctors who are a lot more open, especially for themselves, in trying some of these herbal strategies. And yet there's still not a lot of great guidelines on how to wield these very complicated substances that are herbs. And so what endobiogeny brings is a lot of of data and information on how to properly use these herbs, both in terms of selection, herb interactions, herb drug interactions, dosing, and so forth. Now, towards the end of my career in emergency medicine, I had one of my colleagues approach me, and he said, "Hey, I wanted to point this out to you. There's this recent article that appeared in this Journal of Emergency Medicine, and it says that night shift workers in the ER cognitively perform much better if they take rhodiola before their night shift." And I look at him and I said, "I told you this like 12 years ago, and you ignored me." And so luckily, there's a lot more openness to this, and but if you really, really want to have some uh, wonderful guidance in how to properly use these herbs, endobiogeny is it's the premier place to learn about this. Endobiogeny uses herbs from traditional European herbalism, Persian medicine, Persian herbalism, South American herbalism, Ayurvedic herbalism, Chinese herbalism. All those traditions are those herbs from all those traditions are integrated and used as an endobiogenic practitioner. And yet I use them very differently than a Chinese medical practitioner or a traditional herbalist. And why what I do is different? It's because I'm matching an herb to the person's terrain and the physiologic disturbances that I am seeing in their mathematical modeling. So it's a very different approach. This is an example of some of the results that you can get through running labs through some of these panels that I'm describing, the mathematical modeling. So you have an adrenal balance panel that indications include fatigue, allergies, depressive tendencies, etc., exercise intolerance. It's very simple. All you need is a basic CBC with differential and platelets, and you get there's another thyroid screen that is used to evaluate metabolic syndromes, coronary artery disease, diabetic neuropathy, cognitive impairment, asthenia, fatigue, weight gain, chronic fatigue. All these things can be evaluated by this simple panel that it only includes a TSH, T4, T3, very inexpensive tests. The uniqueness of the panel is the relational view of how we're analyzing things using the mathematical modeling. A spasmophilia panel, again, looking at anxiety tendencies, depression, exercise intolerance, migraines, asthma, allergies, etc. An allergic panel, immunity panel, inflammatory tendency panel. All of these can give insights into evaluating somebody with autoimmune diseases, hyperimmune diseases, migraine tendencies, uh, uh, mast cell activation syndromes, and so forth. Even into the mental health space, anxiety, depression, there are physiologic drivers that can be identified in somebody's laboratory analysis if you know how to look. And that's what the mathematical modeling provides. So this is an example of results from the thyroid panel. All you need is a TSH, T4, T3, and you can get these results, and then you have an interpretation on one side, and then you have um, a list of possible interventions from pharmaceutical to plants to trace minerals and dietary considerations. Even lifestyle recommendations can be incorporated into the set of recommendations. An example of some of the recommendations that would be listed in terms of some nutritional guidance as you are helping your patient, as well as lifestyle recommendations. So as I go through my evaluation with the patient, as I listen to the patient and then I evaluate their data using these GEMMA panels, I give them a set of recommendations, and my recommendations come in the form of in four areas. I give them recommendations related to pharmaceutical interventions. Which pharmaceuticals would be appropriate? Do we need to adjust what you're on? When and if is it appropriate to try to wean off of a particular pharmaceutical? I give them The second area that I give them recommendations include medicinal plants, herbs, and medicinal mushrooms, for example. And the third area is related to any nutritional guidance. This can be trace minerals, it can be vitamins, it can be a therapeutic dietary direction. And then the last area that I give them are recommendations in lifestyle, whether it's based on their modeling data. Is it most appropriate for them to engage in a meditative practice or a certain type of exercise practice, or more have a discussion related to sleep hygiene, for example. These are all part of lifestyle interventions that can be give us some direction when we're looking at their modeling data. So this slide is just an example of endobiogeny versus just our our usual method of just quantitative testing. If we're evaluating a condition such as let's take anxiety, this bottom one. For a small lab panel that costs approximately $150 in the US, you can get a level 3 anxiety panel that really gets a lot of data in terms of the dynamic unfolding of how your body's managing hormones like serotonin, oxytocin, GABA, endorphin balance, cortisol levels, and so on. Whereas your typical functional labs testing, urinary neurotransmitters and so forth might cost upwards of $350 and take a month to get back. So it's a very cost-efficient way of doing things, and it's also a very different way of doing things. And I just want to emphasize that it is one thing to get a blood level, and it is a very different thing to get an idea for how efficiently your body is using a certain uh, a certain neurotransmitter or a certain hormone. You can get, for example, a testosterone level, free or total testosterone. You can get a sex hormone binding globulin. That's helpful information. It is, I do that a lot for my patients. That gives us helpful information, but it's completely different to try to get an idea for not just a blood level, but how well on a tissue level is your body using that hormone? That's a very different question to ask. And that's what the mathematical modeling is able to provide. So how it works, we have lots of treatment choices, and in terms of um, um, whether it's pharmaceuticals and so on. But based on the physical examination, the biomarker analysis and history, we have a very thoughtful selection of interventions. And we use pharmaceuticals, medicinal plants, nutritional interventions, and lifestyle recommendations. Why it benefits your practice. So I ended up completely leaving emergency medicine altogether. For a while, I didn't. For a while, I continued to practice emergency medicine through the lens of endobiogeny, and I would take this framing of the world, and I used it to help my patients. And that was I could still do that, but endobiogeny was so compelling to me, and I needed a different space for doing it. So I left emergency medicine. I took a big risk and I started my own practice. And I do endobiogenic consultations full time. Now, you don't have to do what I did. You can keep doing your regular practice. If you have a practice in psychiatry or neurology or gastroenterology or cardiology, pulmonology, just about any specialty, if you have a practice in general medicine, family practice, or internal medicine, you can keep doing all of those and add a level of guidance and use endobiogeny to further inform and help your patients. You can keep doing what you're doing, and just add a extra color, extra flavor, extra value to your patients by doing an endobiogenic evaluation as well. And some of you might find this, like I did, compelling enough that you want to devote your entire practice around this type of evaluation. So this is transposable into your current area of expertise. It's flexible. You can use history exam, biomarkers. It simply expands your knowledge base, and it adds a profound amount of insights and deep knowledge. Um, it supports a transition into a very satisfying and potentially even lucrative patient-centered care model. Now, I actually did not change my careers in order to make more money. In fact, it was probably even in the end. I initially lost some money when I left the emergency medicine before I built up my practice. And right now, I'm about financially about exactly where I was when I was practicing emergency medicine. It, I, the financial part of this was not the compelling argument. For me, it was a more satisfying way of viewing the world and treating my patients. It helps better solve unsolvable and untreatable conditions. A few essentials about endobiogeny. It combines holism and physiology. evaluates the entirety of the patient, both basic function and the person in its environment, how it's adapting to seasons, to this moving universe around us. And it reduces a lot of costly tests. I had a consultation the other day with a patient, a new patient, who is actually has a background in integrative and functional medicine. We started a consultation, and we had I did the endobiogenic laboratory evaluation from the outset. And we had our set of diagnostic tests that we went into the evaluation with. And his comment to me was really interesting and actually a bit illuminating. He looked at the number of labs that I ordered and he said, "This looks very, very simple." And I don't think he was being derogatory, but it did illustrate something very interesting. The set of lab tests that you need to do an endobiogenic evaluation is very, very simple. It's not typically very expensive at all. Compared to some of these very extensive and elaborate and obscure biomarker assays that some people do, we can derive a lot more information from a very simple set of labs. Again, getting back to my analogy with this box of IKEA furniture, you have all the right parts in your box, but if you still don't have an answer, well, then you start doing more elaborate tests. You try to test the nature of the wood in the box. Is it the right wood? Is this the right humidity of the wood of this piece of furniture? You start getting more and more elaborate in terms of what you're testing. But what endobiogeny does, instead of doing more and more complicated tests, it simply looks at how that piece of furniture is put together, the timing, the unfolding, the intensity of signals in your physiology. That's what we can derive using a very simple set of biomarkers. And it's very patient-centered and with a wide range of treatment options. So, in short, endobiogenic systems thinking. Really, the way I see this is it's not either or. You have all of our different types of practicing medicine, whether it's you're practicing traditional herbalism, or you're practicing cardiology, or you're practicing neurology or psychiatry, whatever you're practicing, it's not that endobiogeny is some other type of medicine that is still trying to share a part of the sandbox to play in. Endobiogeny it can surround and encompass all fields of medicine and add insight and depth to all of our ways of practicing medicine. So that's what I wanted to share with you in terms of my both what endobiogeny is, what makes it unique, and in my view of the world, quite revolutionary, and why it's not just normal medicine, business as usual, and why it was so compelling that I left the emergency medicine to do this full time. So I want to just take a quick break and thank you for being patient through all that autobiographical part of it. But do you have any questions before I just briefly touch on the nuts and bolts of the course itself?
So far, there's only one question from Ileana Bagita, and she would like to know if you are a hunter.
I hike in the woods and I sometimes carry a gun because I do like to be part of the process of knowing where my food comes from. But I'm a very unsuccessful hunter. I mostly just like to observe nature. The animals on my wall are my process, or it's my attempt of honoring life. I believe that all life is sacred. Living death infers life, life infers death, and I honor the beauty in nature. As it turns out, I actually purchased those animals that are hanging on my wall from a farmer in Poland, of all places. So they are not native to my area, but the animals in my area look like those horns, but they are about twice the size. And and by the way, just this morning there was a herd of animals like the ones on my wall, but bigger, of about 100 outside of my office this morning. So,
Oh, wow. Thank you for sharing. And those are all the questions for now.
okay, great. So just I don't want to take a lot of time for this part. Maybe you've heard it before. If you've participated in some of the other webinars. This is just going over some of the nuts and bolts of the course. I hope that what I presented was compelling enough that you are interested and you want to know more. That's my goal. And ultimately, beyond just signing up for this course of endobiogeny, I want you, my vision for you is that you are better equipped to do good in the world, uh, and make your patients healthier, make yourself healthier, and that's what I hope you ultimately get out of this. So the course of endobiogeny is who is qualified to take it? Well, there's a few helpful characteristics. Hopefully, you are interested in holistic medicine. Hopefully, you want to transform your practice style and adopt some of these ideas. It's really helpful if you both have a level of mental openness and depth. Now, it's a lot of people who maybe were trained in Chinese medicine or Ayurvedic medicine or traditional herbalism. Often the openness part is not a problem for them. They're open to this idea of using herbs in a very medical oriented way. Um, and sometimes people who were trained in a very classical Western medical tradition might not be open enough to that sort of thing. Now, I just would say if you want to approach this, it's nice to have both a very fun foundational depth in understanding medicine and physiology, but it also is nice to have a level of openness to therapeutic modalities that includes pharmaceuticals, that includes herbal medicines, that includes lifestyle, that includes diet, that includes nutrition. That's really helpful to have that level of openness. Who's it for? MDs, DOs, nurse practitioners, physician's assistants, and any PhD in the life sciences. In the US, people who are trained in Chinese or Japanese medicine also have could be qualified to take this course. In the US, naturopaths as well. And then in the UK, university trained medical herbalists. The course, it's a 6 months course. And really, this is designed in order to really acknowledge that we all have a life, we have families, we have a career. It's not likely that any of you are able to take time off of your busy practices and families and so forth, and do a fellowship or another set of elaborate training in endobiogeny. So this course has been designed to be able to be reached by just about anybody who is eager to know more. It's self-guided and it's a 6 month course. There's it's broken into modules, one module per month, and there's a combination of guided readings, and then there's a lot of help with this in directing you. There is a self-assessment quiz to make sure that you are getting the fundamentals down, and then at every month there are lectures that are didactic, and and then there's another lecture that's live that's experiential, where we go over case studies where we help you and start spoon feeding you how to interpret these lab panels, these the mathematical modeling. That we help walk you through that process, and we put a lot of hopefully practical insight into this in helping you understand why this is relevant and making it real and not just theoretical for you. And then at the end, there's a certification test. Now, some of you might get into this coursework and find that you're excited about it, and you think, I have a colleague that should really learn this. It is you can join the course even late in the game because it's really self-guided, and even if you miss some of the didactic and experiential lectures, they're all recorded, so you can go back to them and review them later. There's a very lenient window of timing of how fast and the pace that you need to get through the coursework. But we'll be there to help support you through this. So, as an example, Module 1 starts in June, and ideally, very beginning of June, or even maybe even into May next month, you can start reviewing the course material, and you can do the self-guided learning. There's a syllabus that you can follow and just help support you through that. And then on June 21st, there's that weekend, there is a didactic lecture, which will be recorded. And then there's the practical aspect, which is also going to be recorded, but this is starting to go through how we apply it to clinical medicine. And initially, the first panel that we'll be reviewing is related to autoimmune tendencies and thyroid disease and these thyroid panels. Module 2 is going to start in July, and this is starting with uh, things like the pineal gland, which is I see that as really the pacemaker of how we adapt to life, starting with the pineal gland and going into a deeper level of thyroid functional panel reviews as well as adrenal panels. And so there, again, there's both the uh, the um, the core material in terms of the theory that we're going to be going over, as well as the practical aspect of how to interpret these lab panels, how to understand them, what are the treatment offerings that can be understood from these, and how do I start incorporating it into my practice. Uh, Module 3 gets into these hormones of anabolism, of growth hormone of estrogen and testosterone and so forth. And we also get into this idea of coupling or yoking. Often in endocrinology, we look at hormones within their axis. We look at the thyrotropic axis. We look at the corticotropic axis. We look at the gonadotropic axis and the somatotropic axis. But what this starts to get into here is how those different axes influence and modulate one another, how they're connected. We're missing something when we simply look at thyroid function only in its axis, because it's also influenced uh, by other axes as well. And so we'll get into that as part of the training. Module 4 is more the essentials of clinical endobiogeny and new panels that involve uh, uh, this process of detoxification, or how we're more efficiently able to clear metabolic waste from our system and from our emunctory organs, these organs that help us our exhaust system that of our bodies, as well as again how our hormone systems are connected through yoking. Module 5 is further understanding of how these biomarkers are understood and constructed, and giving us a little bit better understanding of how these biomarkers are helping us see things in less of a quantitative fashion, but more of a qualitative fashion of timing and efficiency and intensity of signal and so on. And we'll also get into the allergy and further adrenal panels. Module 6 is putting it together in a more it's just every step of the way we're adding more depth and complexity, and we're also going to be getting into more therapeutics, including medicinal plants and so forth. And we'll be covering topics that relate to anxiety and autoimmunity as well. And then in the end, there's going to be an exam, and you can choose to take that exam or not. And if you pass the exam with 70% or above, then you have passed. And then uh, if you score higher, you can pass with distinction or even higher with honors. There's a couple of pathways to certification. One is the simplest is that there is no additional fee. You take the exam and you get a frameable certificate saying that you have been certified in the science of endobiogeny, and that does allow access to these panels that we've been describing on that you can incorporate into your practice. And pathway 2 is a level up. It's certified mastery in endobiogeny, and that's taking the exam plus writing an essay that you'll have some direction and assistance with. This essay is intended to demonstrate your mastery of the concepts. There's an additional fee for that because there's extra mentoring that goes along with that. There's extra assistance in writing and so forth. Now, there's a third pathway, option 3, and this is the timing for this is adds an additional 18 months if you need it to this process. This is to demonstrate exceptional mastery and contribution to the science of endobiogeny. So, in addition to taking the exam, you are required to write a publication quality monograph or case study, and this also includes an extra fee, and that fee is because, again, there will be mentorship and there will be assistance and there will be article reviewing by fellow endobiogenists that help with the methods of analysis and materials and manuscript production and so forth. But as you do that, again, that's just an added layer of mastery in this field. So what does the course tuition include? It includes all the course materials, the book, in ebook format, any sort of supplemental material, which is optional reading. It includes access to workshops and case studies. It also allows for uh, access to the mathematical modeling, the GEMMA program at the Explorer level for 6 months. And the earlier you sign up for the course, the earlier this can be activated so you can start becoming familiar with that even earlier. It also allows access to all the course videos for 6 months after the course ends. And you have some flexibility, of course, in when you take your final examination. It also includes the certification in the science of endobiogeny. Final steps, you can register for the training by going to this URL here at training.systemsbrg.org. You can learn more at systemsbrg.com, and then you can explore more about these panels that I've been referring to, the mathematical modeling, by going to gemmabio.com. And that is, I believe, all I had to say about the coursework. Any questions about that? hopefully I didn't rush through that too fast. Hopefully you could understand what I was saying. Um, any questions?
So there's a question about your GEMMA presentation.
Yeah.
And the question is, if a patient takes allopathic medicine and GEMMA gives us a therapeutic aid which is not compatible with the patient's medication because of the adverse reactions, what should we do in this case?
Oh, well, you don't, first of all, you don't have to follow all of the recommendations that come from the GEMMA panel. Now, there are going to be limitations to what the recommendations from the GEMMA panel can say. For example, it might not know all of the current medications that the patient is already on, and it might give a recommendation that is contraindicated or has a significant interaction with herb drug interactions, often there will be, if there is a concern, it'll often be listed. And then just like any any modeling tool, let me just give you a few examples. There are very elaborate mathematical models that try to understand moving targets. Uh, there are models to understand the global marketplace and the financial systems. There are models that help us understand weather patterns, and there are models that help us understand wildlife populations and ecology and climate change and so forth. These are based on mathematical models, and some of these models related to global market shifts are very powerful and robust, and they are imprecise and imperfect. But that doesn't mean that they're not helpful. You can make a lot of good, informed decisions. All that is to say is that what these panels also offer is a way of trying to understand a moving target. And if you're trying to understand a moving target, there's always going to be some limitations. Does that mean that they are uh, not helpful? Not at all. They're very helpful, and every tool has its when you're trying to understand a moving target is limited in its ability because the system we're trying to model itself is moving. So that is a complicated way of saying that everything that all of these recommendations that these panels give you need to be contextualized, and you don't have to follow all of them. In fact, you don't have to follow any of the recommendations. You can simply look at what the interpretation offers. I do this all the time. I look at these recommendations and I say, well, I'm going to that's helpful insight, but I actually have experience with this other drug or herb, and I'm going to stick with this, or I'm going to change it this way. This is not going to dictate how you practice medicine. You are going to have to still use the brain you were born with.
Thank you.
Other questions?
Those are all the questions for now.
Well, thank you for hanging in there. And hopefully this was something that was valuable to you. And I hope to see you on the other side in this course. I will, as I said, be one of the helpers in doing some of these didactic lectures as you go through the coursework.